Hello and welcome to this recorded presentation for the employees of Performance Titanium Group. This discussion will be around the Employee Benefits Program effective December 1st, 2025. My name is Bill Hammond. I'm honored to be your insurance broker. My contact information is on the screen along with Ana Narvaez and Arceli Velasquez. Both of them speak Spanish. Both of them can help you throughout the year if anybody needs any help understanding the plans, figuring out how a claim went wrong, getting new ID cards. If we can help you choose a plan during this open enrollment time, if you have questions about doctors that are in the network, whatever it may be, we are here for you. We are here to help you. Quick agenda, we'll talk about the timeline of open enrollment, medical plans available, dental vision plans, how are you going to enroll, as well as where do you go with questions. Open enrollment dates and deadlines. For those of you listening to this throughout the year, all the information is good. These deadlines don't really apply to you, but for those listening right here during open enrollment, it is October 15th today. Open enrollment is beginning now. It goes 1 week to Wednesday, October 22nd. This is the time of the year where you can enroll employees. Enroll yourself, your dependents. You can disenroll dependents. You can change plans. You can add or remove dependents. Any changes that you make during this period will be effective on December 1st. We're asking that everybody complete this enrollment no later than Wednesday, October 22nd. We have 8 medical plans available, 5 HMO, 3 PPO. We'll go through the detailed differences in them in a moment. But the Trio HMO plans, when you see Trio, you're thinking Scripps Doctors. The Trio HMO plans are going to be the lowest cost plans available, but they do limit you to generally Scripps Doctors. There is one Platinum Access Plus HMO. This is available for those of you that would like to have access to more than just Scripps from an HMO perspective. For those of you that want lots of freedom of movement, lots of ability to go see almost whoever you want, these PPO plans will be very helpful for you. Also, in understanding the plans and the costs in general, Silver plans are going to be some of the lowest cost plans. This means the least amount of money coming out of your paycheck, but also the most money out of your pocket when you go to access your benefits. The gold plans are going to be a little bit more expensive than the silver plans, meaning you're going to pay more out of your paycheck, but when you go to use them, there will be even less out of your pocket. So a lot less you will spend on hospital stays, MRIs, prescription drugs. In the platinum plans, these are going to be the most expensive on a per paycheck basis, but they're going to ask the least amount of your out-of-pocket expense when you're at a hospital, doctor's office, or some facility. Here's our silver and gold HMO plans. We have 1 silver plan and 2 gold plans. Notice how these plans differ. A little higher deductible on the silver plan here. The gold 1500 is a lower deductible. The gold 500 has the lowest deductible. This is in ascending order of cost. So your silver plan will be the lowest cost, the gold 500 highest cost on this particular graphic. As we kind of go down this spreadsheet here and understand the terminology, I want to go through it with you. We'll use the silver plan here. We have a $2,300 deductible. That means a deductible, generally speaking, means this is what the amount is you must pay out of your pocket before the insurance company starts to pay. So deductible, the higher the deductible, the more out of your pocket you're paying upfront to utilize healthcare. Now, there are a number of exceptions. Wherever you see this term DED waived here, this means you get a flat dollar copay without having to meet that deductible. So if I join this Silver Trio plan and I need to see a regular primary doctor, I'm going to have a $70 copay, which is payment in full. I do not need to meet my deductible first. I get that from day one, $1. And if I want to see a specialist, I'll pay $80. Again, deductible is waived here. You just pay the copay. If I need blood work, that's $65. If I need an x-ray, that's $115, deductible waived. Be paying attention here as we look to the right. The more expensive plans, look at how much lower the cost is out of your pocket to utilize care. So on the silver plan, I'm paying $115 for an x-ray, and the gold plan here is almost half that price at $60. CAT scans, PET scan imaging, MRIs. If you go to a freestanding facility, they waive the deductible and it's only a $100 cost. If you get this service, MRI, CAT scan, PET scan in a hospital, you're going to pay $400 after you pay your deductible. All right. So notice all these plans have a higher cost when you're utilizing this particular service inside of a hospital. When you are referred to take an MRI or get an MRI, you want to make sure you're asking for a freestanding facility. If you don't know how to find one, call member services and they can help you locate one. It will save you hundreds and hundreds of dollars. So we go down here, we have a brand name drug deductible. You'll see this on certain plans. This means for an individual, somebody enrolling by themselves on this silver plan, you would have to pay the first $450 of the brand name drug cost. Generics are not a part of this. Brand name drug cost, you pay the first $450, and then you have access to these copays of 85, 110, 115, 155. The 900 is if you have family members, anybody else in the family. So there could be more than 450. So no one person pays any more than their 450, but if you have a spouse, a kid, they would have their own $450 deductible, no more than two of those per family. We'll talk a little bit about these level A and level B pharmacies on the next slide. Notice down here, 40% after deductible for hospital services. So how this would work, what this looks like is if I'm on the silver plan and I have a $100,000 hospital stay bill, I went to the hospital for a week, it's $100,000. I would pay 100% of the cost for the first $2,300, and then I pay 40% of the cost. Blue Shield pays 60% of the cost until my total out-of-pocket expense, including my deductible, including my 40%, including any doctor visit copays or prescription drug copays. Once I have spent in total $8,750 or this out-of-pocket maximum, once I've hit this number, I pay zero for all covered services for the rest of the calendar year. Okay, so that $100,000 hospital stay visit will cost me $8,750. It will not cost me any more than that. And for the rest of the calendar year, all my doctor visits, prescription drugs, hospital stays, physical therapy, x-rays, labs, MRIs, all of it's covered 100%. I pay zero. So just notice how these other plans, these more expensive plans have a 20% cost share. They also have a $300 copay for a surgery and a $300 copay for emergency room after the deductible, whereas this plan is 50% out of pocket. So you see how these silver plans can save you money out of your paycheck, but you only really want to buy it if you really do not expect to really utilize much of your healthcare plan. Because as soon as you go to the hospital, have a surgery, or go to the emergency room, you are going to spend all of that savings back and higher deductibles and costs. So we talked about level A, level B pharmacies. Remember here we have, say, generic drugs could be 25 versus 30, or on maybe this gold plan, level A hospital, level A pharmacy is $60 for a tier 3, but $90 for level B. So what is a level A pharmacy? So level A pharmacies, CVS, Costco, Safeway, Save On, Vons, this is where you want to go. If you've got the Blue Shield plan, you want to direct yourself to CVS, Costco, Safeway, Vons. Very likely there's one in your community. This can save you a lot of money. You can also go to level B pharmacies like Walgreens and stuff like that. But again, you're going to be paying these higher co-pays because you're at a different level of a pharmacy. So it really is a meaningful benefit. How do you find a preferred pharmacy? BlueShieldCA.com/pharmacy and select pharmacy networks. Here's our other two HMO plans, our platinum plans. Notice we have zero deductible. Notice we have very low out-of-pocket maximums. Notice we have very low copays. Notice now we're getting into flat dollar copays for hospital stays. So if I am to the hospital, I'm not paying a percentage like I am here. I'm paying a flat $250 a day, each day, not to exceed 3 days. Surgeries are 150. Emergency room visits are 250. So these two plans are very, very good, but they're going to be the most expensive. The Platinum Trio, again, this is our Scripps plan. The Access Plus, this is the largest network of doctors. This will be one of the most expensive plans we have offered. If you're happy going to Scripps doctors, there's no need for you to go to the Access Plus. You only go to Access Plus if you need Sharp, you need UCSD, you may need some other access. Here's our PPO plans again, silver, gold, and platinum. Silver is going to be the least expensive way to get into a PPO plan. Platinum's the most expensive, best benefits. The reason why you might consider a PPO plan is because you value choice. You value freedom of movement. You need to be able to go to Sharp for a regular doctor visit, Scripps for a specialist, and get a surgery at UCSD, whatever it may be. You need to have a lot of different plans and different doctors that you can go to. PPO plans will give you the most choice, but they will be the most costly out of your paycheck. Blue Shield also has a concierge program. These guys can help you finding doctors, getting prescription drugs, getting records transferred, helping understand how your plan works, talking to pharmacists, health coaches, social workers, all kinds of stuff that can help you on your healthcare journey, that can help make this an easier process than it usually is, which we can all admit has been very difficult. So please connect with the Blue Shield Concierge Department if you have any issues. The phone number is down here below. Here's a little plug for the app. If you want to know the single most important thing to do to manage and help your benefit experience be as positive as possible, it is having this app on your phone. You must do it. You really, really must. You can find doctors, you can find pharmacies, you can locate urgent care providers, you can talk to doctors, you can find all kinds of stuff, very, very important stuff. In the next several pages, we're going to talk about some value added stuff. These things are all available through the app as well. Speaking of, so let's talk about mental health. There is a lot of help through the Teladoc program for mental health and other services. Sure, cold, flu, allergies, respiratory infections, all that kind of stuff, fine. But did you also know that you can get help and talk to people about mental health struggles that you have? So the phone number is down here. There's other ones you can call. So here is a great one. So 1-800-TELEDOC is something that is important. You can go to blueshieldca.com/Teladoc. You can do medical consultations, mental health consultations, all of it 24 hours a day, 7 days a week, 365 days a year through making an appointment. And then 7 a.m. to 9 p.m. local time, 7 days a week, you can talk to Teladoc. Speaking of mental health, this is a little more on your own, if you will. They have services called wellvolution.com/mental health. They have something called Headspace, which is a really, really awesome meditation app, helps reduce stress. Really, really cool thing to listen to, maybe help going to sleep, or maybe that point in the day where you just need to meditate for a couple of minutes and get yourself back to center and move on. We have Fitness Your Way through Blue Shield. This is offers you discounts on gym packages, at-home workouts. So down here on the left, you can go to fitnessyourway.activityhealth.com/BAC. Lots of different ways you can access this. So this down here is how you would go about finding that information. Also, Life Referrals 24/7, really cool stuff. Go to lifereferrals.com and enter the code BSC. You can get personal counseling, legal assistance, financial coaching, identity theft resolution, referrals to parenting resources, child and elder care, meal programs, transportation help, all kinds of stuff. And this is part of your health plan. So let's talk about dental. We have 3 dental HMO plans. HMO dental plans are great because they're very low cost. There's not a lot of per paycheck cost to these, and they give you a couple of free cleanings for free. They cover all the basic and major services, root canals, implants. They cover orthodontia. They cover all of it. But the problem with an HMO plan is you have far less choice of who you can see. So HMO plans are great because they don't cost that much, but they don't have as many providers in their network. And sometimes working with HMO dentists can feel like it's a lot of extra work, like they're always trying to upsell you. Now, the PPO dental plans, also through Delta, this is going to be a much better experience. There's a lot more providers you can see. The dentists get paid more by using a PPO dental plan. They're easier to work with. You're not being upsold quite as much. But there are 2 major drawbacks. The first of which is it's a lot more expensive. Your HMO plan can be, $8 to $12 a paycheck. Your PPO dental plan is going to be $20 to $40 a paycheck. So it's a lot more expensive, but you have a lot more choice. The other drawback is the calendar year maximums down here at the bottom. So these maximums mean once the insurance company, Delta in this case, has spent Let's say we have the gold plan, $1,500 of benefits on you, then they pay nothing else and you pay 100%. So this is a per enrolled person calendar year maximum. All right. So if you're on the dental PPO plan right now and haven't used a lot of it, please go in and get a checkup, see if there's any work you can get out of the way before the new year starts so you can start the new year with a full $1,500, $2,000 maximum calendar year benefit. The silver and gold PPO plans use the Delta PPO network, and the platinum PPO uses the Premier network. It's one of the largest PPO networks in the country. Our vision plan, there are two of them. Both of them have the same exact network of vision providers you can see. Both of them give you a $10 copay once every 12 months to get a vision exam. Both of them give you a $25 copay every 12 months to get new lenses. But the gold plan has a $200 frames allowance that you get every 24 months, and the platinum plan has a $250 allowance you get every 12 months. I believe the platinum to be a much better value of a plan. It is less than $2 a month more expensive, yet you get $250 a year every year on frames or you get your $200 allowance for contact lenses. The gold plan makes you wait every 2 years for this benefit, and it's lower. So I like the platinum plan. We have a little microsite for you. This is a great place for you to go to get information. I'd love for you guys to bookmark this site. This is a great first stop for anything and everything related to everything we're talking about here. This presentation will be loaded into there. There's a link to our YouTube page where we've got hundreds of tutorials from what's an HMO to a PPO and how to choose a health plan. As you scroll down, all of these different bars have drop downs where you've got lots of different trainings, lots of different resources, login guides for ease, training on how to find benefit details, report a qualifying event. Each one of these drop downs will give you dozens of resources for Blue Shield, for pharmacy, for family planning, the Choice Builder dental and vision member resources. And then Healthcare Explained, there's a lot of different videos again for your information and learning should you need it. Also below there are the contact information, contact details for our office, as well as for the insurance companies. If you keep scrolling down, the insurance companies that we represent. So it's a fantastic resource. So enrolling in these offerings, you'll do through the Ease Benefit Portal like we've done in the past. You will be getting this email here asking you to log in. You'll hit the little green login button down there. You'll land on your homepage here, which is performancetitanium.ease.com. You'll start enrollment. You're going to make sure you're at the dashboard here and you start enrollment. Hit the start button on the next screen. Enter your personal information. Go to the next page. Add any dependents you have. If you don't, you can just hit next. Now you get into your medical benefits page. You want to make sure you hit this check mark so that you have plans to select as you scroll down. If you do not hit the check mark, if it's all gray here, you're not going to be able to select any medical plans. So hit the check mark to indicate you wish to enroll and the X to decline coverage for any dependents that you might have. It will ask you for a reason. This is mandatory. There is an option to put other and none of your business. If you don't want to tell us, it's totally fine. But you need to have one of these checks or X's marked. You'll scroll down, you'll choose your plan. You'll continue to do that through dental and vision. You're going to review all of these plans. You'll hit the continue button once you review that is correct. You will then hit sign forms. You will type your signature. You will use your mouse or your finger if you're on a tablet or a phone to sign it. Hit next. It'll take you through all of the applications and have a little green box. You just need to simply click or touch in and it will insert your signature wherever it's necessary. Once you do that, you're going to go all the way to the end and hit finish. You'll get an email that says thank you for submitting your benefit elections and you're all done. So the next step is looking for that Ease invitation and login, logging in and making your choices by Wednesday, October 22nd. This should be relatively easy for most of you, seeing as how we're not making any changes to what we offer and all of you had something already in there. Everything that you were already enrolled in will be pre-selected for you. So if you just want to keep things as they are, should take you just a couple minutes. If you have any questions, if you need any answers, we're always happy to help. Thank you for sticking through this whole presentation. I really appreciate your time. Take care.